also NatCon MTV Dialogues. So today we have amongst us a legend who has really contributed significantly in shaping India's TB response. Professor Rajendra Prasad is a name who's a signature almost for, who has been passionately working for ending TB. One of the very few legends who has been the president of probably all important professional associations related to TB and chest diseases, whether it is National College of Chest Physicians, Indian Chest Society, Indian College of Allergy and Asthma and Applied Immunology, director of Vallabhbhai Patel Chest Institute, former, and he was also former director of the Institute of Medical Sciences in Saifai, professor and head of Department of Respiratory Medicine, King George's Medical University, KGMU, and currently, sir, you are involved with the ERA Medical University. Of course, involved with the National Task Force, and your CV is so long, so awarded, so decorated. Thank you so much, sir, for joining us. It really means a lot to us to get your insight. So, sir, first of all, we'd like to have your blessing. Sir, where are we in the fight against TB? Where do you see? Because you began when the RNTCP began in '97, and even way before that, sir. So, over to you.
Thank you, Bobby, for really, I'm seeing you for last so many years. So, as you have asked a question that where we are as far as TB elimination or NTB strategy is concerned, which is currently in a process. No, I have been involved in TB control from 1976 onwards. Our department, KGMC, used to take part in the National TB Control Program at that time. And we have injected streptomycin and given 6 tablets of isoniazid. That was an intermittent regimen those days. Then I saw the conversion into the revised National TB Control Program. I was very lucky that we are the ones who started RNTCP in medical colleges. And KGMC was the first DOT center to be established in medical college way back in '96. So since then we are seeing it now. RNTCP, name in 2019, it has been revised as a National TB Elimination Program. Why this name was changed? Because we are moving towards elimination of TB from the world, including my own country, that is India. We have progressed a lot. There are a lot of new investigation. If I remember my PG days in 70s, we used to get drug resistance report in 6 months, 8 months. Today, thanks to the new diagnostics like Gene Expert, like LPA, like LPA2, and even gene sequencing has come up in a great way. Now we can boost that. We can diagnose drug resistance tuberculosis in practice about in 1 week's time. So that's a great change has occurred. In this change, I think the India has also contributed. The TrueNet machine, which is totally an Indian machine, and it is as good as a Gene Expert, and lot of centers it is being used. Then on the treatment front, you see, we have all new drugs. Whatever is available in India. I have been part of many these guidelines, and we have seen the metamorphosis, changing regimen from longer regimen to shorter regimen to newer long and all oral regimen. Injections are phased out. So we have very good regimen to treat tuberculosis. And my perception how it is going to be in future. I see future. I usually talk that as we have universal DST today, we'll have universal treatment for tuberculosis. Probably 1 or 2 treatment that will be for all sorts of treatment, be it drug sensitive, be it various forms of drug resistant tuberculosis like MDR. That's my dream actually, and I hope in my lifetime it will be fulfilled. So as I said, I'll repeat again, as we have come to first we come to the universal access to the all health, and then we come to the universal DST, diagnosis. Everybody whom we are treating today, we should know whether it is drug sensitive tuberculosis or drug resistant. My dream is the way science is moving. I believe that it will be having a universal treatment for practically all also. And what would be the beauty of universal treatment? A lot of studies has come, even guidelines WHO has changed in 2020 last year, when we have got a shorter regimen for drug sensitive TB. Even 3 months regimen is available. Although in country it is going to be, I think very soon it is going to be followed. For drug resistance we have come to 6 months. So that thing has already happened. But what is my concern and worry is, science, I say, never fails. Science has done his job best. Whatever is possible in diagnostic, in therapeutic, even in preventive. You know, in the prevention of tuberculosis, which is very essential. If you want to end TB from the world, which program is running today, finally culminating into TB elimination, without the preventive treatment, without the new vaccine, probably it would be difficult. So we are moving towards that. Preventive treatment has been introduced in India very well, and vaccine, I think, we are hoping that it will come soon. So these things will ultimately, will be able to eliminate tuberculosis from India also. Although our Prime Minister has made it 5 years earlier, so 25 is not very far off. We are talking in 24. I hope that, and only problem I see sometimes, as I said, science is not at the fault. The implementation, that's a big word I always say. If we have been able to implement thoroughly and very religiously, where should be the TB? Because I am teaching tuberculosis last 50 years by now, and my first slide always shows that TB is 10% curable disease, provided you write the correct prescription, and from patient side, you make your patient that he consumes those medicines. If these two things are met, we have new diagnostics, new therapeutics, which is going to change the scenario of tuberculosis in future.
Yeah, thank you so much, sir. It is really important what you just said. Everything is so important and resonates so well. I'll come to treatment and other, but your first slide statement was so important. So 50 years for teaching tuberculosis, mentoring doctors and healthcare workers, influencing program and policy decision makers, and this is a huge impact on the TB program. And thanks to people like you that we are where we are today. And sir, only 21 months are left to end TB in India, and it's a human rights imperative also. As you rightly said, TB is preventable, curable, but it was not so because for 10.6 million people who got TB last year. And you are right, we know what to do, but the gap between what we do and what is happening on the ground, that is the divide which we probably need to bridge, which we have already. So let us talk about diagnosis. UP, I was reading in newspapers, UP found 100,000 new cases, additional cases last year, 2023, because it deployed WHO recommended diagnostics at the block level. It was the screening using tools like X-ray, not just verbal screening, so asymptomatic. So can you share your insights? What more needs to happen, sir, in next 21 months so that we are really able to eliminate TB?
Yes, I think in next 21 months is very important for this country, as it is the dream of our beloved Prime Minister Sri Modi. And only thing what I see, as I said, I'll repeat that science-wise we are very good. Every regimen, whatever word has, in India we have all those regimens free of cost. But the probably we have to work more on implementation. We have to involve society. It has to be, already it has been made in India. Probably we have to increase it as a social movement, that everybody who got tuberculosis must come to these centers where free of everything is free, and must complete the therapy if we really want to fulfill this dream of and I always say that time has come. It is not only the doctors, it is public. it is whole society has to work in a mission mode. So wherever there are cases of tuberculosis, they are detected, they are treated. I am pretty sure from my 50 years experience, if every patient gets the good treatment and he completes, we are going to meet somewhere this at the end of 25. If we are not able to meet it even, say for a loud thinking, at least we'll reach nearby. And the movement has been there in India. You know, it has been made as a Jan Andolan bana diya gaya hai. And this has to be propagated further, it has to be improved. Implementation issues has to be very, very careful things. The vaccination is another thing. If India can produce vaccine COVID, which is supplied for many countries of the world, so India should move forward, and it is moving. I know that it is moving forward. Hope to get very soon a good vaccine which can prevent. Even you know in India, the adult BCG vaccination has been started in the program very lately, and I think that might help in eliminating the tuberculosis.
Sir, given your experience in the last 50 years, we will like to take your insights. Sir, the way we convert scientific tools or scientific, when you say science, so when we get new diagnostics, new treatments, new vaccines, there is a long delay before they get converted into public health impact. So look at molecular epidemic came in 2010 and it was 2024, and still in the world I think 47% got diagnosed with molecular test. So more than half are still getting diagnosed with microscopy which underperform. I think we need to do way better in translating that. Like you said, a good example of COVID vaccine. It was discovered, made, produced, delivered in the arms of people across not only in India but several other countries worldwide. What more needs to happen, because the treatments are there, 4-6. So my question is that when a new vaccine comes, whenever a new vaccine comes, TB, safe and effective, we need to have a proven path to deliver it to. So right now right now what we have in hand are 146, 1 month treatment for latent TB. We know we have a 4-month treatment for drug sensitive, for 6 months for drug resistant. We have the best diagnostics and screening tools. Should we demonstrate that we can really reach the unreached with these new technologies?
Asthma is very, very important, and every doctor, I suggest that in every visit to the patient, they must train and see that patient is taking those inhalers properly or not.
Thank you, sir. And before we let you go, one last request. World Social Forum is happening in Kathmandu in February 2024 from 15 to 19. On 18th February, the only session of tuberculosis, which CNS is co-hosting with the National TB Program Kathmandu and Stop TB Partnership. Sir, we would like to message for that. We will, in the audience, we will have social movements who are working on a range of issues, housing, range of other issues. But the only session on tuberculosis is the session where we want your opening remarks.
Yes, my best wishes for that particular conference. And what as a social movement, what I can say that probably everyone in the society has to be involved, has to move in a such fashion that every patient of tuberculosis gets diagnosed and treated. And you know that TB is a social disease. It's not only the diagnosis and treatment is going to solve. There are many other issues like poverty, like many issues. I think everything has to be tackled together to eliminate TB from our society.
That's a very important message, sir, about social disease. And these are also risk factors, right? Important risk factors for TB, malnutrition. Thank you so much, sir.
Thank you, Bobby. Thank you.